This is a condition that usually occurs on the lower legs in adults. It tends to be more common in men, and it usually presents as red-brown or golden brown macules or patches, often with small red dots, also known as petechiae, within them. Uh, these petechiae, this appearance in one form of pigmented purpuric uh, dermatitis is analogous to cayenne pepper spots or cayenne pepper. Histologically, uh, we have the epidermis here, and then within the superficial dermis there is chronic inflammation composed of macrophages and lymphocytes. Within this background, there are extravasated red blood cells, and frequently there are also macrophages that contain brown pigment within their cytoplasm. The brown pigment represents hemosiderin, and these are called hemosiderin-laden macrophages. While hemosiderin-laden macrophages are a common feature in pigmented purpuric dermatosis, they are not necessary for the diagnosis. The most common form of pigmented purpuric dermatosis is Schamberg's disease, although there are other forms of pigmented purpuric dermatosis, including a lichenoid form and an eczematous form of this disease or condition. Here again at high power are the extravasated red blood cells with associated chronic inflammatory cells. Sometimes the clinical differential might include stasis dermatitis, in that condition there is typically a proliferation of blood vessels without significant inflammation and usually without hemosiderin-laden macrophages. The differential would also include a small vessel vasculitis, also known as a leukocytoclastic vasculitis, and in that condition you would typically find neutrophils with fibrinoid necrosis of small blood vessel walls and nuclear debris from these broken up neutrophils, and this is not present in this biopsy. Here again is a high power showing the lymphocytes, which are the cells with the small dark round nuclei, and the macrophages, which have more abundant cytoplasm and have these oval vesicular nuclei. Now, the cause of Schamberg's disease, as well as other pigmented purpuric dermatosis, is not known. Contributory factors include venous hypertension, exercise, capillary fragility, alcohol intake, especially when there's concurrent liver disease, and gravitational dependency, such as from prolonged standing. Rarely, it may represent an allergic reaction to a medication, and rarely it may represent an allergic reaction to textile dyes, particularly blue dyes and those containing azo dyes. It could represent a reaction to rubber products such as in boots, and there are also reports of pigmented purpuric dermatitis associated with contact with sap from the agave plant. Pigmented purpuric dermatosis may also be associated with systemic diseases.